Hello, in this video, I'm going to talk about non-specific low back pain and exercise recommendations. So what is non-specific low back pain? It's low back pain or pain in the lumbosacral region where there's no identifiable cause of the pain. So they may have had an MRI or x-rays or they other diagnostics, and there's no clear identifiable cause or identifiable pathology or injury that's causing the pain. So non-specific low back pain is really a symptom, not a diagnosis. Or it is sometimes referred to as a diagnosis of exclusion, meaning that we've excluded everything else it could possibly be, so let's categorize it as this. And so non-specific low back pain really includes everybody with low back pain where we can't figure out exactly what's causing it. So it can be caused by a combination of structures. So it could be nerve roots, muscle, fascia, bones, joints, intervertebral discs, visceral organs can even be referring pain to the low back or located directly in that region. And so all of these different anatomical structures can be part of the cause, or any combination could be causing the pain. But there's nothing that has been identified through diagnostics or examination or anything like that that is clearly identified as the cause of the pain. So the treatment, what's interesting is it used to be that you have back pain, you go to the doctor, and sometimes it could take, a month or more to get in with the doctor. And then they might refer you to see a specialist, and then they might send you for diagnostics like an MRI or other things. Then there's the follow-up with the doctor, and then they send you to physical therapy. So that's a common kind of chain of events. That's how it used to be. The new approach is to send you immediately to a physical therapist who will apply a conservative program because they don't necessarily know what the cause of the pain is. And then if that program is not working very well, or there's new symptoms or anything like that, then you go to the doctor or you go to the specialist, you get the diagnostics and so on. Because physical therapy is so effective for low back pain, and that's often the end result of the whole cycle in the old approach. And so why not start there, see if it works, and then if necessary, then go to the specialist and follow up with further diagnostics. So for treating non-specific low back pain, you want to have modalities that are decreasing the pain. So for some people, that could be applying heat, it could be applying cold, it can be work to restore mobility, so range of motion work, it could be massage. There are all sorts of modalities that, depending on the person and the symptoms that they're having and the type of pain they're having, there's all sorts of modalities that might improve their pain. So the goal is to hasten recovery, to resume activities of daily living as quickly as possible so that they can preserve their physical independence, their comfort, and their emotional wellness. Anybody who's had low back pain, especially if it's sharp or severe or long lasting, knows that it can be a scary situation. It can cause some emotional response, especially if it's restricting your ability to work or participate in your family life and so on. So the idea is to restore normal activity as quickly as possible and decrease pain as quickly as possible. So exercise recommendations, again, are similar to our normal healthy adult, but with less intensity on both the cardio and the resistance training than is normally recommended. And you want to avoid kyphotic lumbar postures because they cause long spinal levers. So kyphotic lumbar posture means essentially flattening the lumbar spine or lumbar spinal flexion. So the normal curve of the lumbar spine is lordotic. So that's that kind of backwards curvature. That's the normal, natural lordotic curve of the lumbar spine. So kyphotic curvature would be in the flexion direction, and we want to avoid that. So I'm going to explain a little more about that here. We'll go into some erector spinae mechanics. So erector spinae, that's the whole group of muscles that are going all the way from your sacrum to the base of your skull. And that includes, and they're also called the paraspinals, and that includes all those different muscles going all the way up and down the spine. So their primary action is an extension of the spine, but depending on which one and on which side, they might also cause some lateral flexion and so on. So lumbar flexion, so we go into that kyphotic position of the lumbar spine. So flexion or flattening of the lumbar lordotic curve changes the biomechanics of the erector spinae muscles. So here we really need to consider the moment arms. Okay, so we're looking at the distance between where the muscle force is applied to the axis of rotation, or where the fulcrum is in the movement. So a longer moment arm will mean that the muscle is at a greater advantage and therefore can produce less force to produce the same movement. If we have a shorter moment arm, then the muscle is at a worse advantage. So it has to produce a greater amount of force to overcome that disadvantage to cause movement. So erector spinae in general already have very small moment arms because of their location and where they are relative to the axis of rotation, or the fulcrum, which is right there in the spine. So they're already very short moment arms. And when we go into lumbar flexion, then they become even shorter. So we're further shortening already short moment arms, which means that in a flexed position, erector spinae has to contract to a greater extent and produce more force to produce the same movement. Okay, so that's why we want to be careful about avoiding that flattened lordotic curve or too much lumbar flexion. We need to be careful about that, because then we're causing the erector spinae to have to contract to a greater extent to function normally. They must activate to a greater extent compared to other positions, and this may alter the erector spinae's ability to resist and control flexion, and changes the compression and shear forces in the spine. So as we are bending forward, as our spine is flexing, erector spinae is contracting eccentrically to control that movement. As we're lowering down, it's controlling the movement against gravity. Okay, so as we go further into that flexion and the moment arms of erector spinae are getting shorter and shorter, it's having to contract to a greater and greater extent as it's lengthening to control that motion. So the problem gets worse and worse the further we go into flexion. So what that means is, for somebody with low back pain, we need to be careful to limit our extreme range of motion in the flexion direction. Hyperextension, we have a very similar problem, but for a different reason. So when we go into hyperextension, so now we have a hyperlordosis, we're hyperextending the spine, and that can be on purpose, like in exercise, or it could be poor posture. But when the spine goes into hyperextension, it also requires erector spinae to contract to a greater extent to produce, or to produce the same movement, because now we have an issue with the length tension relationship. So remember, the amount of force that a muscle can produce depends on the length of the muscle and the amount of overlap of the sarcomeres in that muscle. So when we're hyperextended, erector spinae are already in a shortened position, or at least somewhat shorter than in neutral. And so because of the length tension relationship, we're not going to be able to produce as much force in that position, because if the sarcomeres are already very much overlapped, there's not very much room for further overlap as the muscle contracts. So there's that optimal amount of overlap that allows for the greatest amount of contraction. And that's what we have closer to a neutral position of the spine. So in hyperextension, we have to have a significantly greater amount of contraction to produce the same amount of movement, because the length tension relationship is interfering with the ability to produce force. Okay, so essentially what I'm saying is avoid extreme range of motion in either direction. So be careful about too much hyperextension and be careful about too much flexion, because in both cases, erector spinae have to work overtime. And in somebody with non-specific low back pain, more contraction, more activation of erector spinae is probably not a good thing, regardless of what the actual anatomical cause is of the pain. It's just likely to make it worse. All right. Thank you so much for watching, and I'll see you in the next video.